Okay, this video is how I view doctors, and it's sort of, how I sort of see the medical system. Basically, there's a lot of fields that are very logical, and they're steady. They don't change much. They're pretty much fixed, almost written in stone. And there's little incremental, small improvements, but they're pretty fixed. Okay, so that would be like surgery, the NPCs, no patient care fields. That word comes from the book House of God by Samuel Shem. For fields that don't have that much patient contact, ER, emergency room. These are what I would call relatively logical fields that are predictable. There's some nonsense in every field, but not that much. In general, medicine's much, much, much better at making a diagnosis than it is at treating most diseases. And there's some fields that are great at diagnosis but stink at treatment. Okay, so as far as surgery, my opinion over the years has changed. When I was a medical student, I considered going into plastic surgery, but my father called it prostitution of a medical degree, and there was sort of a contempt for a plastic surgeon. They're a bunch of lowlifes, just help women get big fake boobs. Was that a stupid waste of an education? But now that I'm older, I kind of see plastic surgery as more of an honest deal. I mean, the woman comes in, she wants big boobs, she gets big boobs. She wants a facelift, she gets a facelift. And women love plastic surgeons. Gosh, being a plastic surgeon is like being a rock star. It's the biggest, most glamorous field in medicine to be. I remember this one girl was like this turbocharger fox, and she's going out with a plastic surgeon who was like 15 years older than her. And I'm like, there was no way some other guy would go out with that girl unless he was like a rock star or a plastic surgeon, okay? And I'm like, wow, that's interesting because I never thought of it before. I'm like, plastic surgery sucks, A lot of guys do general surgery for 5 years, kind of miserable sleep deprivation for 5 years, and then 2 years of plastics. Is that really worth it? Just to do, breast implants, kind of a waste of time, I thought at the time. Anyways, yeah, I still wouldn't want all that sleep deprivation. That makes you kind of grouchy and stupid. Okay, transplant surgery, ortho. Okay, what I'm basically trying to say is these are pretty standardized fields. They do a lot of good stuff. They're especially good for acute problems like general surgery. They're real logical. ENT, urology. I did tons of stone removal cases. They're ENT, like urology, for example. What they do for stones is very logical and good. For prostate cancer, they know what they're doing, but I think they operate too much on prostate cancer. But what I'm trying to say is there ain't nothing going on but the rent in most surgical specialties, okay? Cardiovascular surgery. They're much better at helping a person with valve disease and coronary disease. But again, nothing's changing much, and there's no surprises, and they are what they are for good, for better or for worse. There's some good and some bad. NPCs, no patient care fields. Pathology is amoral. You just read the slide. What is the cytology, individual cells, histology, gross? Okay, fine. Radiology, also, it's kind of amoral. That's one of the things I kind of liked about it. I felt I could stay in touch with adult medicine, pediatric medicine, male and females, and I was initially excited about the surgical aspect of it, interventional radiology, imaging guided surgery. Later on, the neuroradiology working on the brain. Dermatology does have, patient face-to-face patient contact. So NPCs in general don't have much face-to-face patient contact. But they joke about dermatology. You just scratch skin and give steroids. Obviously, there's more to it than that, but it's still kind of sort of a clean and easy feed. I thought about going into derm, but my friends told me, derm is bogus. You don't you're not really involved. You're not part of the clinical team to take care of patients. But then again, when I got older, I'm like, gosh, dermatologists make good money. They got good hours. The women love those guys. I'm like, not a bad field. Okay. All right. Emergency room. I really have a lot of respect for all the stuff emergency rooms deal with because the patients come in with acute problems and they usually have a relatively clear cause and they have a clear-cut workup, initial treatment. They provide a lot of value to patients, get them out of acute situations. But the vast majority of patients have chronic problems, all the obesity, diabetes, hypertension, coronary artery disease, impotence type stuff. In the medicine fields, I talked about it in just my most recent lecture. The science in internal medicine and the related internal medicine subspecialties is the worst in all of medicine, by far. It's all totally distorted to claim the cause is unknown so that drugs can be sold. And it's much less predictable, sort of what's going to happen to these patients and what needs to be done. But it's just a lot of drug dealing. So anyways, as far as like the general intelligence of the medical subspecialties. Now, by the way, these are just general average ranges. And I'm only talking about academic IQ. When I say academic IQ, I mean the ability to get a good grade on a test, the ability to memorize what you need to memorize to take a class in medical school, basically. So that's an academic IQ. And a person might have an academic IQ in one area, let's say 120, 125, and they might have a much higher academic IQ for humanities or some other intellectual field. Plus, there's different types of intelligence. There's also social intelligence, like for example, in social intelligence versus academic intelligence. For academic intelligence, I'm so much smarter than my wife, she can barely have a conversation with me, okay? That's how I am with lots compared to lots of doctors, okay? But when it comes to social intelligence, she's way smarter than me. She kind of controls me, turned me into a chump. She spends my paycheck. I don't, okay? So there's different types of intelligence, all right? So we'll just get that out of the way. But when I say grunts, I mean this is like the majority of healthcare practitioners are in what you would call primary care. Face-to-face patient contact. I talk to the patient a lot, and they work through the day-to-day issues. This includes your nurse practitioners, a lot of your physician assistants, psychologists, physical therapists, podiatrists, internal medicine doctors, family practice doctors, okay? Then the medical subspecialties are docs that did a fellowship after an internal medicine residency. They're like endocrine, which takes care of diabetes a lot, for example, also thyroids and other less common endocrine problems. And like I said, in my experience, I've talked to a bunch of them. Not a single one of them has even read the basic introductory level papers on diabetes, which I find very funny. It's like one of the most common diseases, tons of stuff published on it, and the fellowship trained doctors who teach the residents, and I talked to chiefs of department in endocrine, don't even know the basics of diabetes. It's amazing how little they know. It's shocking. Any patient that just decided to sit down for 1 week and read the papers on diabetes, they would know more about diabetes than people who run endocrine residency fellowship programs. I'm 100% certain of what I just said. I know that from a lot of experience, okay? It amazed me. So that's what I mean by they don't have a lot of intellectual curiosity. You could finish a fellowship and only have an IQ of around 120, probably 115, finish an endocrine fellowship, practice your whole career and be fine because there's nothing demanded of them intellectually, okay? I mean, I was amazed. They hadn't even read the Sweeney paper, or they didn't know about the Rabinowitz work. They didn't know any of this stuff. Somebody who becomes an internal medicine section chief. So the grunts, I said I gave them a ballpark IQ 115 to 135, and there's also plenty of really smart ones, okay, that are way smarter than I know. Some internal medicine doctors that are very, very bright, okay. Dr. McDougall's an internal medicine doctor, okay? He's a brilliant guy. All right, so anyways, medical specialists, they tend to be a little bit smarter than the ones that just settle for 3 years of work. A lot of them don't really like academics too much. A medical section chief often has an academic IQ 130 to 150. So a lot of these guys, let's say a internal medicine section chief or a medicine fellowship section chief at an Ivy League school, that person's going to have a relatively encyclopedic knowledge of what you would call conventional medicine. Match the ill to the pill and send a bill. All right, but they're still not going to know anything about surgery or toxicology. So they still can't cure any of the chronic diseases. So it's kind of a joke, internal medicine tries to be so prestigious, and it's really in many ways kind of a big joke because they mostly treat chronic diseases and they don't know anything about what causes chronic diseases and they don't know how to cure them because they don't know nutrition and toxicology. So it's a little bit of a big joke. Let's see. Yeah, and they'll sometimes do stupid stuff. Like I knew this one MD, PhD doctor who was so jealous of me, wouldn't even read my book or talk to me. I had another doctor who told another doctor friend of mine that my book should never be shown to medical students because they're patriarchal and misogynist. And I'm like, well, what the hell was that all about? Because I made a joke that a lot of times the treatment for leaky gut is a fecal transplant. And so I said, well, if a wife has leaky gut, maybe instead of getting a fecal transplant, she could just kiss her husband's ass. I was just joking. But that joke was patriarchal and misogynist. It's just a joke, okay? Anyways, let's see, what else? Surgical subspecialties. Surgeons tend to be a little bit smarter. Not always. There's plenty of stupid surgeons too, but they tend to be a little smarter because you can't fake surgery. I mean, you have to go in there and do a procedure, and you better know what you're doing because if there's a complication, it's more likely to be immediate and obvious. They tend to have big egos too. A lot of being a surgeon is about having a big ego. Because, a regular person, they're like, why the hell? Surgeons tend to be sleep deprived during their residencies and fellowships. They get exploited like slaves. So it's not good for your health or your personality to be sleep deprived. A lot of them are kind of grouchy, but, I hung around with surgeons a lot and I like them, but I'm just saying, is it worth it for a lot of surgical fields? I don't think it is. Especially like general surgery. The patients are so sick. I thought it was kind of miserable. Even though I liked the other general surgery residents and the fellow, I didn't like the way the patients are so sick. You couldn't joke around. You can't joke around if the patients are dying in the ICU. That's not a time for joking. Whereas on ortho rounds, bone broke, must fix. It's kind of binary, and they often don't even manage their clinical medical issues like the electrolytes. They turf that to a consult in internal medicine or something. All right, anyways, AOAs. AOA is Alpha Omega, and that's sort of like the top 10% students in the class the first year. Like if a third year junior students in pre-med, it's like top 10%, top 20%, I think now for seniors. I'm not sure about the senior year AOAs. Of course, made it the first time around. So they tend to have IQs academic IQs in the range of 140 to 170. And they usually go into some type of subspecialty, medical or surgical. And they maintain high standards. I know lots of radiologists in this category. They maintain a high standard of conventional medicine. And like I said, radiology is pretty much, you look at the film and you read it, okay? There's no moral thing. There's no ethical thing. You just read the film and say what's on there. But one of the things I noticed is these persons tend to have a relatively encyclopedic knowledge of their field, but they're also almost always conformist in their thinking. All these radiologists I talk to, and I know a lot of them, they tend to just repeat whatever's in the book, and the book tends to be adequate for reading the film. But the book doesn't tell you how to understand the disease. It doesn't tell you how to give intelligent advice to the patient or the referral doctor beyond this is what's on the film. And also, most of them didn't have any interest whatsoever in doing original work or reading in other fields. Most of them don't read on their own. Because I know these people. I talk to people like this every day. People who do research too, like if you go to some big fancy medical center or Ivy League place where there's a lot of people doing research, almost always it's micro questions. When I say micro questions, that means it's working within the field of conventional thought, trying to answer the small next question in line of things that follow conventional theory, whatever conventional theory is. So that would be, for example, like if you're doing research on Alzheimer's, trying to come up with a cause for beta amyloid and going down that sort of silliness. All right, macro question scientists and innovators. These are really rare, and they're always at risk to be fired. So it's kind of a dangerous thing to do. They usually don't get much money, if any money, for doing this. These tend to be like the smartest people in medicine. Okay, they have academic IQs in the range from 145 to 200. And by the way, IQ is a very changeable thing. Okay, a person who really wants to get good at something, they will get much better at it. For example, most of the doctors I know haven't read a medical book since they finished their training. Okay, you can go to see me, just sign your name, and then go to the beach all day. All right, it's kind of a big joke. So what I'm saying is, if a doctor, let's say they finished their training at 30 years of age, wants to really learn their field and keeps reading on a routine basis, a little bit every day from the age of 30 to 45. By the time they're 45, they'd be one of the top 2 or 3% in their field at least, if not the top 1%, because there'd be very few other people in their field that have kept reading and studying and went through the literature and read in adjacent fields. So, but there's zero incentive to do that. Usually they're exhausted. They finally say it's time to get married and have a kid, and that's what they do. And then that keeps them pretty busy. Between the job tends to work them into the ground and get as much, money out of them as it can by working them into the ground. So they're exhausted, and they just got a little bit of energy left over for their family, and that's it. But the really smartest of the smartest in medicine, the ones that are willing to take the risk, try to do original work. When I say macro question, I mean answer big questions, change theories. And I've seen some of them. For example, this Ann Osborne lady was awesome. She's like the queen of radiology, a neuroradiologist. She redesigned the textbooks, wrote the best brain neuroradiology textbook ever written, started her own company for publishing textbooks with Amersys. They then got sort of bought out by Elsevier, and they have really beautiful textbooks, and they run that website, statdx.com, which is a great radiology website. So, she really sort of transformed the publishing textbook industry and neuroradiology book business, and very strong on pathology and whatnot. So very aesthetic, elegant, great. Okay, I actually know her. I actually wrote a book for her, and she was really nice to me. A lot nicer than the other publishing people I've worked with. Don't get me wrong, I worked with some pretty nice ones. But anyways, this guy Tom Nadich, top of the line encyclopedic mind in neuroradiology and neuroanatomy and functional MRI. Clyde Helms. I mean, so these are some of the ones. And again, sticking to nutrition here. Michael Brownlee, MD, and Gerald Shulman. Brilliant the way they figured out at a microscopic level that excess fat causes diabetes, insulin resistance. Richard Moore, we talked about him with regard to the sodium potassium pumps and hypertension and calcium metabolism. And then here's a whole bunch of nutrition experts you've probably all heard of if you follow my site. All these great ones in nutrition. And so basically, when you go down this path, usually you're going down a lonely path, and you're very lucky if you're skilled enough to turn it into money. But that's where new ideas come from. That's where hypotheses that refute the textbooks, refute the conventional theories. But like I said, you run the risk of losing all your income because you get fired because you piss off the conventional medicine, which is based on big pharma. And so it's not too glamorous a path. So it's pretty understandable why a lot of these real smart people, they have zero desire in any of this stuff. It's frowned on as like a bunch of crap, okay? Because it's like, why take a risk of getting in trouble or getting fired when you don't get any money for it? So it has to be, you have to have like ethical feelings that make you do it, or some of the people in this category figured out how they can make money on it. But anyways, that's kind of how I view the whole big game, and that kind of explains why medicine is what it is. The money comes from selling your drug or doing your surgical procedure, which has a billing code, and you get paid for it, and it's all logical and it's all standard, versus doing original stuff. That's not standard. You can't get paid for doing original things because they don't fit into the billing code system.